So I think the most important risks fall into three categories. First, there's the developmental risk. So we're seeing the highest injury burden in younger adolescents, particularly ages 11 to 14. We know that this is a group with evolving judgment, higher risk-taking behavior, and limited traffic experience, yet they're using devices capable of relatively high speeds. The second is the environmental risk. So children are often riding in mixed traffic environments without protected infrastructure. Our built environment is not designed with pediatric e-scooter riders in mind, which increases collision and fall risk. And then third is the behavioral and equipment related risks, including low helmet use, high device speeds, and limited safety awareness. So I think these three factors really compound each other, especially in unsupervised setting. So overall, I would frame this risk as a mismatch between the rider, the device, and their environment. And I think that can inform how pediatricians counsel families, in particular families of young adolescents and the risks of these. So these are different than conventional bikes or scooters. They go at much higher speeds. And so things like helmets and using the correct helmet, riding in protected bike lanes are really key because we know from this work that these e-scooters can produce pretty significant injuries. So I think the big takeaways from this is, as you mentioned, the um, major injuries are musculoskeletal and soft tissue, though there are some internal organ injuries and head injuries, particularly in those going high speeds without helmets. And so in terms of the emergency department evaluation, understanding that these e-scooters go much faster than conventional scooters and bikes, and there's a much higher risk for more severe injuries. I think the emergency department encounters are also an opportunity to provide counseling on the dangers of these micromobility devices. So I think the overrepresentation of Black and Hispanic children in e-scooter injuries reflects their differences in exposure and the environments in which they're using these e-scooters. So these e-scooter users are likely operating in urban areas where there's a higher scooter availability. There may be infrastructure inequities, such as fewer protected lanes. There may be differences in their access to helmets and their way that they use these vehicles, whether they're for transportation instead of more recreational purposes. Um, and I think the nuance that you picked up on here is that while there isn't a difference in hospitalization after adjustment, it doesn't mean that these disparities are unimportant. And I think that this really is about the differences in exposure and environment, not differences in the children themselves. And when we understand these risks better, can target our counseling to these individuals. Yeah, I think the important thing to recognize is that no single solution will work in preventing or decreasing these injuries and really takes a multidisciplinary approach. So you mentioned helmet use, which is low hanging fruit, but we know from bicycle literature that talking about this and promoting helmet use and mandating helmet use is effective in decreasing serious head injuries when using micromobility devices. I think every encounter in the healthcare setting, whether it's for well child visits or injury visits, is an opportunity to discuss with parents and children, making sure they're always wearing their helmet, they're always following the rules of the road and speed restrictions. I think at the policy level, advocating for age restrictions on these vehicles, as well as speed limits and helmet legislation, is key. And then the environmental level, thinking about protected bike lanes and safer riding spaces, as particularly for children using these devices. I think the things that I just talked about, so at the policy level, so making sure there are age restrictions, speed limit, and helmet legislation that are enforced for use of these vehicles, and then the environmental level, having the protected lanes and safer riding spaces. I think pediatricians who are seeing these injuries firsthand and daily communicating with these at-risk demographics can advocate for these changes by using personal stories of patients who were injured and their lives were severely affected by injuries as a result from e-scooters.